Hi guys, welcome back to my channel. For those of you new to my channel, my name is Abigail and I'm a mum, a wife and nurse manager. So it's that time of year again and all the nursing and midwifery students are heading back to uni or starting uni and eventually out to clinical placement. And I just want to talk about some of the common issues that occur out in clinical placement and offer tips on how to get through clinical placement. So feel free to share this video and don't forget to like, comment and subscribe. Stay tuned. So welcome back. Let's dive straight into it. I'm going to state the issue, then I'm going to talk about it. So the first one is all I do is wash and feed patients. I haven't learned anything yet. So you basically need to understand the basics of nursing first and understand the fundamentals of nursing. These are most definitely nursing tasks, and as a student nurse, I would use this as an opportunity to settle into the clinical environment and settle into the hospital environment. Because once you start taking on these more sophisticated tasks, it will then become a natural expectation that you're able to carry out the fundamentals of nursing as well as these tasks, and you may not be psychologically there yet. So it's not like you learn your basics and your fundamentals and then drop it. Then you learn how to do wound dressings and then drop it. Then you learn how to do vital signs and then drop it. No. It's more like you learn your basics and your fundamentals, and as you learn more tasks, you add it on to your pool of knowledge and understanding and your pool of skills. So you definitely see this with a lot of third and final year students and sometimes newly qualified nurses, where they become very task orientated and nearly forget about the fundamentals and the basics. So it's good to try and get a grasp of these things and have a good well-rounded knowledge of these things, because it'll definitely help you with planning out your day and incorporating all these things into your day. And even at times when you can't carry out the fundamentals or the basics because you have other urgent tasks that only you can do, you can definitely delegate these things, but you can't delegate them if you don't have a proper knowledge, and you can't incorporate it into your plan for day if you don't have proper knowledge of these things. So the next one is, my friends have been doing a lot of cool tasks on their ward and I haven't. Let's just say sometimes some people can exaggerate what they've been exposed to and what they've actually been allowed to do. Besides, you have to put it into context as well. You may be on a ward that deals predominantly with a lot of social issues. So for example, there's elderly patients waiting to move back into nursing homes, or elderly patients waiting for home modifications and to move back into their homes, versus your friends that are on urology wards, say for example, and they're seeing a lot of bladder scanners, bladder irrigations, urinary catheterizations, or your friends that are on oncology or hematology wards and they're seeing a lot of chemotherapy administrations, dealing with high-tech medications, and seeing a lot of blood tests being done, or your friends that are on respiratory wards and they're seeing a lot of chest drains and BiPAP machines. So you definitely have to put it into context and definitely keep in mind that sometimes people exaggerate things. So the next one is not being involved in nursing skill opportunities. All I can say to this is you definitely need to ask questions and make yourself visible. Say for example, you're in handover and you're getting a handover of your patients for the day. Definitely try and identify some of these nursing skill opportunities and ask your preceptor or your mentor whether you can observe these tasks being carried out if you haven't done it before, or if you have done it before, ask your mentor or your preceptor whether you can actually carry out these tasks while being supervised. But definitely make yourself visible and definitely try and identify these things and ask. So the next one is working within your scope of practice and having to tell the nurse that you can't do certain things that you've been asked to do. So I definitely get this as a nurse, and the lines can be quite blurred between second and third year students, and also between early final year students and students at internship. So I definitely get this. And also the nurse has to think about the workload for the day and also look after you as a student. So you definitely need to try and communicate it in a way that doesn't come across as rude or raise suspicion that you're trying to shy away from work, because that's the last thing you want to do, and it's very easy for people to develop opinions. The next one is using your initiative. So hanging around and saying that you have nothing to do. Whenever you're in this situation, definitely use it as an opportunity to try and familiarize yourself with the ward that you're working in. It's not just about learning how to be a nurse, but also about the hospital system. So learning about how stock gets onto the ward and how hospital equipment gets onto the ward, and things like medication and how that's restocked on the ward, and your oxygen tanks. I'm not gonna lie, I didn't know the ins and outs of oxygen tanks until I was a good year into being qualified. So the next one is taking on tasks for the whole ward. Oh my God, I remember when I was a student, and I definitely have vivid memories of taking on tasks for the entire ward. And it would start off with things like I'd finish my obs for the section that I'm working in, and then it would start off with things like, do you want to see if Siobhan needs a hand with her obs? Or Shola looks like she's sinking and she might need a hand. Or Michael looks like he could do with a hand. And you end up doing obs for the entire ward. So I definitely get it. I was definitely very bitter about it at the time, but looking back at it now with all the experience and knowledge that I have, it was definitely all teamwork. And if I wasn't helping at the time, then I would have probably been standing around not doing anything, and I wouldn't want to be seen as not using my initiative. And also to mention, it's good to show initiative and get stuck into work, because it can be quite helpful for when you need to get signed off your clinical placement. Say you haven't been working with your preceptor or your mentor for the final weeks of placement. It'll be easier to find someone to sign you off if you have proven yourself as a good student and you've been showing enthusiasm into your work and just showing initiative throughout your placement. It'll definitely make things easier for when you need to get signed off and you haven't been working with your mentor or your preceptor. The next one is, I haven't worked with my preceptor or my mentor. This is such a common issue. It was prevalent when I was training and it still is. To be put quite simply, it's such a complex issue to fix. Things like shift requests from both nurses and nursing students are massively contributing factors. And depending on the year that you're in as a student, you can't be rostered to work weekends. So say, for example, you've got a 4-week block placement. The chances are your preceptor or your mentor is going to be working 2 of those weekends. And then throw in a bank holiday. It's just impossible to fix those kind of things. So definitely when you're in placement, use your initiative and get stuck into the work, as it'll just help you sail right through your placement and get signed off. So the last one is, preceptors and mentors get paid extra to teach. Why are they so strict and rude about having to teach student nurses? First of all, where are they getting paid extra to teach? I am very, very interested. In Ireland and in the UK, nurses or midwives don't get paid extra to teach students. It is simply a requirement and there's no incentive behind it. So especially when you're working in the public sector, it's a requirement to teach student nurses. And if you're working in a teaching hospital, it just comes along with the parcel and package of everything. So no, there's no money, extra money being paid, and there's no incentive behind it. When I was newly qualified, I think about 6 months into being newly qualified, I was put onto a preceptorship or a mentorship training course, and that's it. That's the way it is in most places that I know. But if there is a place that they get paid extra, definitely do let me know. So that's it for today. Thank you so much for tuning in. If you would like me to do an extended video on maybe being a student nurse in a clinical area or in college, definitely do drop it in the comment section below. And if you have any burning issues about any of the things that I may have talked about today, or any things that I didn't talk about, definitely drop it in the comment section below. And if you haven't already done so, don't forget to share this video, subscribe to my channel, and like. And I'm also on Instagram, so don't forget to follow me on Instagram at @DNurseAbigail. See you next time.